You know, surgery techniques have come a long way from what they were long time ago. I keep thinking about the scene from Dances with Wolves where they're cutting guys' legs off with a saw. Well, they don't do that anymore. They use a lot more technical things like robotics. And here today we're at Ocean Springs Hospital with Dr. Simpler, who is a general surgeon. How are you?
Good.
All part of Singing River Health System, and we've been doing a lot of visiting different departments of the Singing River Health System here recently. We wanted to come see about the new robotics that y'all do have here, the Davinci. Talk about this if you would, and about your background as a general surgeon.
So I've been a general surgeon in practice here for a little over 7 years now, and I've taken an interest in advanced minimally invasive approaches to surgery and hernia repairs and cholecystectomy, and this device that recently we have available now at Ocean Springs Hospital is really revolutionary in that it has really opened the door to more complicated and complex minimally invasive procedures. And that's what I've kind of taken an interest in, and we're happy to have that here at Ocean Springs Hospital now.
It looks like something out of RoboCop.
Well, it's about as advanced a piece of technology from the standpoint of surgery that we have, and so it's really changing the game from the standpoint of what we can do for our patients.
Now, basically, this takes you as far as not so much direct hands-on with a patient. You're sitting in looking in a unit, moving everything on that, but it gives you a lot less opportunity for, lack of better words, a mistake.
Well, the visualization is much better. We have three-dimensional visualization through very small instruments, and so I think that the ability to visualize the anatomy and to perform complex procedures with wristed 360-degree movement type instruments really makes it safer for our patients and gets them out of the hospital a little faster.
What kind of different surgeries can you do with this, doctor?
So hernia repairs, both inguinal and abdominal wall hernia repairs. We can do gallbladder surgery actually through a single small incision that's basically completely hidden. We can do colon surgery, where patients, we're getting people out of the hospital faster after after doing what is ultimately a pretty major operation. And basically anything minimally invasive that we had been doing leading up to this, we're doing it with our current technology, and that's really, I think, improving outcomes and decreasing the risk of problems for patients.
Do you have your patients to find that, for the most part, a less downtime as far as recovery with using this as to general surgical procedures?
Well, when we with this type of technology, we're able to do operations that we would normally have to do with big incisions, and so even compared to what we were doing with just normal laparoscopic procedures, we're able to do bigger hernias, deal with more complex problems with smaller instruments and less invasive type procedure, and we're able to get people back to work, out of the hospital, back to their normal lives much faster. Now,
the procedure time, is it a shorter amount of time that it takes to do, let's say, a gallbladder removal or even hernia repair? Is it less time doing it with this than it is, with regular surgical procedures?
It really depends on the procedure itself. Roughly, time saving is really not as much of an issue. It's really roughly about the same time to do the operation. Sometimes a little longer depending on what we're doing, but getting the patients back to kind of their normal lives is really where it really shows. And so it's the getting over the operation, the aftercare is really what's improved.
Well, as you were saying, when you use this as opposed to general surgical procedures where there might be larger scars, there might be more downtime and everything like that, with the Davinci unit, it's more finite, meticulous work there that you do that, as you said, leaves a very small scar, if any.
Right, and well, there's always a scar. Compared to our open operations, they're smaller, and we're able to basically with three-dimensional visualization and the high definition cameras, we're able to with do very meticulous dissection, almost we would have our hands wristed inside the patient's abdomen, just on a much smaller scale, and do operations that just like we would be doing open, with the same kind of flexibility and better visualization. So in that aspect, it's a big improvement on a lot of open operations or laparoscopic operations that we do.
Do you see this possibly down the road being used for more advanced, more serious type of surgeries? I mean, cardiac, different things like that. Possibility down the road of doing that.
Well, they're doing that now. They're using it for to remove parts of the lung, or to do certain operations on the heart. They're
bypass surgery, things like that.
They're already moving that direction. So that's already being done. So I think this really opens the door for a lot of opportunities here at this hospital.
So people have probably have less to worry about whenever they're coming in, and you go to your doctor or whatever. You're going to have some surgery, and depending on what it is, I had hernia surgery a few years ago. And I was in and out in 45 minutes. Mm-hmm. And it's amazing. It's like all of a sudden you're asleep. Next thing you know, your wife's standing and saying, "Come on, let's go. We got to go. We got to go."
That's right.
There's nothing to it. And with something like this, it's pretty much that way.
And we're able to get people back over those kind of hernia surgeries and operations that normally we would have had to done in the past with a big incision. Mm-hmm. We're able to do those with these smaller incisions now, thanks to this improved technology. And get people back to those kind of good recovery times that you mentioned that you had. So
now, when as far as needing something like this, I'm sure that if you're wondering about surgery, you go to your general practitioner. They recommend them to you,
right?
And that's when you go over something like this, as far as this is something that we need to do using the robotic unit,
right? And not everybody's a candidate for it, but we're finding more and more people are, and we're able to. We talk about that in the office once I see you in the office, and we get you down that path and get things going for you.
Well, I know Singing River Health System is very proud about as far as it leaps and bounds. I know they have it over in Pascagoula, and now that you have it here in Ocean Springs too, which makes it very, very good for the folks in Jackson County or any other surrounding area that need to come over here and have some surgery.
That's right.
Thank you so much.
All right, thank you.
Really cool that the technology that has come so far ahead here with the Davinci units, and hey, no telling what they'll end up be showing you within the next month, next year or so, but we'll definitely keep you up to date. Again, if you'd like some more information about that, check with your general practitioner if they recommend you for a general surgeon here with Singing River Health System.